Hello and welcome to Traditional Chinese Medicine. My name is Christina Kapothanasis. I'm a licensed acupuncturist and Chinese medicine doctor in the state of Hawaii. I am board certified under the NCC AOM, and I'm a graduate of the Shanghai University of Traditional Chinese Medicine in Shanghai, China. I studied there for 5 years and I am fluent in both English and Mandarin Chinese. I had started a series of case studies for my subscribers, and I was hoping to make it a little easier on myself, so I've slightly changed the format to see if I can create more videos for you on a regular basis. And my new idea is to follow the patients week by week because they're fresh in my mind. I just saw a girl this morning and you can see how her visits progress. The only problem with this plan is if the patient does not adhere to my instructions and/or if she's not able to book on a regular basis, then we might run into an issue, but we're going to try this, so bear with me. Her initial visit was this morning, and she has so many symptoms that it's hard to say what her chief complaint is. Though on her registration forms she noted neuropathy, migraines, and shoulder tension for 10 plus years. She's a female and she was born in 1981, and it is now 2021, so she's about 40. Her blood type is B positive, which you know is important for me. And then we will go through all of her symptoms in no particular order. She has aversion to heat. My registration forms ask a lot of detailed questions. They may not be reporting on these symptoms by themselves, but I have questions to lead them through so I can put together all the pieces of the puzzle. So she has an aversion to heat or heat sensitivity. She has above average sweat, as in she moves a little, she sweats a little. She has daily night sweats. The pain in her head radiating down to her neck and shoulder and her hands and feet. I'm assuming her head and neck and shoulders is associated with her migraines, and her hands and feet are the neuropathy. The pain level ranges from 4 to 8. It is constant. She feels it 100% of the time, and it is affecting her daily activities, as in it is inhibiting some activities that she can do. Her migraines are daily, and she is experiencing those at a level of 4 to 5 pain level, though she does take medications, which I will go over her list in a minute. The reason why I chose her is she is so complicated. She has so many symptoms. My heart sank when I skimmed over her registration forms this morning because my heart goes out to this poor gal. I feel so sorry for her. So we're going to try to make her better ASAP. She also experiences itchiness daily, and the itchiness is on a scale of 1 to 10. It's a 6, and she only started to develop the itchiness when she added thyroid imbalance to her list of symptoms. I need to clarify if she has hyperthyroid or hypothyroid. I'm pretty sure it's hyperthyroid, but I will clarify next time. She also has palpitations weekly, where you feel the heartbeat, and she has daily bloating. Her energy on a scale of 1 to 10 is 4. She goes to bed at 10 p.m., but it takes her 2 to 3 hours to fall asleep, and she only sleeps for 4 to 5 hours. And in that poor short sleep time, she wakes one time to urinate, and she also snores. For her appetite, she is always hungry and she is always thirsty. Her bowel movement is every 3 days. It's brown and it ranges from pebbles to formed like a banana. And she will not have a menstrual cycle unless she is induced by drugs. Her last cycle was on February 3rd of this year. It lasts for 7 days. She has 4 days of heavy flow, bleeding 4 full pads each day. And the color is bright red to dark, like red wine. She has many clots ranging from nickel to dime to quarter size. Her cramping level is moderate. She has loose stools and breast tenderness. And after speaking with her, we also added the thyroid to the list and endometriosis stage 4 after she told me that she has been trying to get pregnant for a few years. And we know time is of the essence. At age 40, we were running out of time. I told her that we cannot focus on the fertility until we get some of these other things under control. But she is, I think, on track to do IVF with her doctors. She also suffers from high blood pressure and high cholesterol. And she had a history of temporary numbness 10 years ago. The doctors associated it with stress. Okay, so that's all her symptoms. That's it. Only everyone on our list. For her list of medications, which we will hopefully be getting knocked off one by one, the poor thing has no allergies, but she is on amlodipine for high blood pressure. She's on Synthroid for her thyroid. She is on Lyrica for her neuropathy. She is on rosuvastatin. I don't know this statin, but all the statins are in the same class. I'm assuming it's for high cholesterol. She's taking vitamin D because her labs show that she has low vitamin D. She's taking Wellbutrin and Cymbalta for depression and post-traumatic stress disorder. She's taking a nasal sumatriptan. I usually hear people take oral sumatriptan for their migraines, but I guess in this case she has a spray and naproxen, and she's taking an anti-nausea medication that I haven't heard before. I used to think I have heard of all the drugs, but this one is Phenagrin for pain, nausea, and vomiting associated with her migraines. And for her insomnia, she takes trazodone and melatonin. And that is so much. I feel sorry for her poor stomach, liver, and kidneys, not to mention the fact that she has to swallow all those pills. Okay, so this is her initial intake, and then we go to what we're going to start doing to make her better. First of all, she's going to stop the intermittent fasting that she has been doing over the last month, because I do not like intermittent fasting. People cannot last very long on it. Usually after about a month, they start going into adrenal fatigue. And then she's going to start with our beautiful clean diet, which you can refer to all my videos on clean diet. I told her to do as little grains as she could, even the grains that she's allowed, but she can still have a little fruit and a little nuts. And I started to test her for beef liver pills and magnesium lotion, but she is so hot and dry that she is not able to handle these at that time. We also, I usually give people a chance on the food before I start them on the herbs, but because she is so severe, we jumped right into the herbs. And I know that her pulses are not real starting off, which many patients' pulses don't start off real at the beginning. I took her pulse, and her heart, liver pulses both look pass, which is impossible with her scenario, and her kidney pulse is 25%. Then on the right side, I took her lung, spleen, and large intestine pulses. Her stomach, spleen, and large intestine pulse looked pass, and her lung pulse was down to 25%. So if I see this pattern of kidney and lung being the only two that are relatively weak, I know she's in adrenal fatigue, but you can obviously see she's in adrenal fatigue just from her chart. So I looked at her tongue, and it's really not as bad as I expected it to be. It still has some pink color, not sheet white, which is excellent. And she has a little bit thicker of a coating than should be, but it's not terrible. And underneath, she doesn't have a lot of stagnation. Her veins are pretty skinny and nice. After I put the needles in, I saw that her liver went down, so her liver was overactive at the beginning, and there definitely needs to be some heat and inflammation cleared, but her kidney just went super overactive and started flipping out. So I know that since she already said she doesn't do a lot of dairy, though I don't know how much she's done in the past few days, I know that her kidney is most likely due to not being able to handle that much prescription medication. The kidney can only filter so much, and when you overtax it with chemicals, it will do this overactive pattern. So we cannot possibly only blame the dairy, especially since she doesn't eat that much to begin with. And because we need to wait a little while for her to start on our clean diet and take out all of the things that she does love, like she said they were a big fan of quinoa, and I said, ooh, hot, hot, hot. And just taking out quinoa alone is going to help some of her heat symptoms. So after she does our diet for a week or two, then I'm sure that her pulses will go down further, which will actually be a good sign, because I know that these pulses are artificially plumped up or inflamed from all of the inflammation that's going on in her body. And I would like you to refer to the first case study I did on, I think it was called Migraines or Hormonal Imbalance, where I drew out on the whiteboard the explanation of the blood and liver and fluid deficiency and how it creates heat in the body, because this girl is a perfect example of that in the extreme, and she's created lots of stagnation, which is seen as the endometriosis. And then she's so depleted and burnt out her liver and kidney and her adrenals that heat is rising, and it is burning out her thyroid, which is her newest symptom, and that is not under control yet, even though they're playing with the medication. Okay, so we want to go back and review that video if you'd like to see my explanation for how all her symptoms go together, because they are along the same lines. Many people are along those lines, especially if you live in Hawaii. Then the acupuncture points that I did to take out the heat were mostly on her wrists and her ankle. I did Naguan and pretend this is your foot. At the ankle on the gallbladder meridian, I did Choshu and stomach Jieshi, liver Zhongfeng. I did kidney meridian Rangu, spleen Gongsun. I did gallbladder Zulinqi. I did liver Tai Cong, and I did her lower abdomen, Qi Hai Guanyuan and Guilai, just to start working on the circulation and give her a little qi. And after doing those points, her pulses initially went off, but I stimulated them a little bit more, and then her pulses went into balance. Previously, I tried to use muscle testing for the points, and I didn't think it worked well. But I've been playing around with another machine that helps to balance your brain waves, and I feel that I'm a little bit more in tune or sensitive. So I've restarted testing the points, and I find that it's really helpful this time, and I'm surprised by what people test for, and I'm using fewer needles, so that's good for the patients. And that's exciting to see even hard pulses balance. Then we went to the pharmacy and I tested her for her herbs. Now, people will test for different formulas every week, which is why it is so important to see a local provider. As I mentioned in my last case study, and I should mention again before I forget, it is too important to take your pulses and your tongue and put it with your symptoms and see what happens after you put the needles in, to get more information on your pulses and to see the changes in the herbs on a weekly basis. And it's very hard to do from a distance. Though I know many people call and want telehealth visits, and I try, but I would really like it if you try to find a provider in your area and you just put my diet with your local provider's acupuncture points and herbs, and it will work much better. So, didn't want to forget to say that. Okay, going back to her herbs, I tested her for her herbs, and I see this a lot when people start off all inflamed and hot, they just will not accept the boosting herbs. She needs a lot of blood building herbs, but she's so hot and dry that she cannot accept them. So I tried moisturizing herbs. Those are more gentle, moisturizing, cooling. She didn't even want those. What she wanted was right to the cold, blood cooling herbs. Now, you would say, we can't give a fertility patient blood cooling herbs. But in this case, we're going to start with blood cooling herbs because she is so hot and dry and just torched that we are going to first clear out the inflammation, and then over time, hopefully I will be able to report on her subsequent visits and you can see how the progression of the herbs will change. So today, she tested for the babiest formula ever, 2 herbs, Sundi and Shensen, which are both in the blood cooling category. They're very moisturizing and very cold. They'll take out a lot of her inflammation, and I gave her 5 grams of Sundi and 10 grams of Shensen. I gave it to her in powder because that's easy. So she'll take 3 spoonfuls a day. And our goals, I also did cupping on her lower back. Cupping is comfortable, it feels nice to the patients, and it'll be good for her spleen, liver, kidney, and getting some circulation to her. Our goals, I said, for a 1 week, we have to have realistic goals so that patients can know what to expect and know that they're on point and feel that they're making progress without feeling discouraged and overwhelmed. I have lots of things I want to do with her, but I need to take it one at a time, and I need to only give her what her body can handle. So if she's going to clean up her diet and start our diet and start her herbs and quit her intermittent fasting, I'm hopeful that within a week we can see significant improvement in her migraines, her itchiness, maybe her night sweats, definitely her stools, and maybe her sleep. And I told her that we will slowly start to, as the symptoms go away, we'll start to check off and take away her Western prescription medications as well, so that her kidneys can have a chance to breathe. And her regular PCP referred her to me, so she likes to refer patients to me, and she's really easy to work with, so we will just work and be respectful and ask if we can take them off one at a time as her symptoms go away, especially for migraines where medication is on an as-needed basis. That one's easier to take off. The order in which I feel that we will be able to remove her medication, I have one point I would like to mention. Her neuropathy pain, the pain in her extremities, her fingers, her hands, and her feet, is not due to a medication, whereas some people have it with chemotherapy drugs. It is not due to diabetes, because she does not have diabetes, even though it runs in her family. And she does not have a specific trauma, an accident to her neck or her lower back, because sometimes it can be a pinched nerve that's causing the numbness in the fingers. So since there's no obvious cause, I'm very, very hopeful that it's just in line with all her other symptoms, which definitely are along the hot. She's so hot that she's very dry, blowtorch, burning off all the fluids. And if she's that blood deficient, especially with endometriosis, which sucks up a lot of your blood, and she has a heavy cycle, well, when she does have it, then I'm hopeful that the neuropathy pain will just be resolved by increasing her blood and fluids, which will hopefully circulate to her fingers and toes. So we cross our fingers for that and hope that it's nothing too complicated, because the chemotherapy neuropathy is a slow healing and the diabetic neuropathy is slower. So I'm hopeful that this one will be faster. Okay, so I'm not sure how quickly her Lyrica will go away, but I think that first her migraine medications will be able to be eliminated. The sumatriptan, naproxen, and the Phenagrin, if I'm pronouncing that correctly. And then I think after that, hopefully if my theory is correct, then maybe the Lyrica will be able to be taken off. And I think last will be the Wellbutrin and the Cymbalta for the depression and the PTSD. And somewhere in the middle will be the Trazodone for the insomnia, though she wants to keep the melatonin. It works for some people and doesn't work for others, so I'm on the fence about that, but it doesn't seem to do bad things to people in terms of their pulses and symptoms, so I don't mind if she wants to keep that. And then hopefully maybe cholesterol medication, the statin, and then her amlodipine. And the Synthroid might also be towards the end, because I need to rebuild everything else up before her thyroid will be able to calm down. So that's hopefully sort of the progression we can do to take it off, and it just depends on how severe they are and how much they adhere to my recommendations. She said 10 plus years she's been experiencing this, but in 2020, which was 2020, that's retired. The Bell's palsy-like numbness that she had was 10 years ago. And that was already after 10 years of severe stress. So we're trying to undo 20 years of severe stress in her job. So we cross our fingers and hope it goes faster rather than slower. And we also cross our fingers that she is able to come every week and thinks that my diet and herbs are not too bad, and she can adhere to our guidelines and bring us back some exciting improvement, and then I will be able to share that with you. I hope this pattern makes it easier for me to share more information with you, because I've been devoting so much time to the Instagram account, which is Chinese Medicine Hawaii, or you can search under my name, Christina Kapothanasis. I've been posting so much about what I cook every day for me and my family, just to show you guys how you're supposed to eat basically. I know I'm not perfect, but I try to be as good as I can. So I've been devoting so much to my Instagram account and the food side of things that I have neglected to keep up with the case studies. So hopefully this will be easier and I can see you very soon. Thank you so much for joining me, and until next time, mahalo.